In Your Health tonight, a commanding approach to ease overcrowding and improve patient care right in the middle of a widespread flu season.
And News 8's medical reporter Jocelyn Mamenda found out what one major hospital in Connecticut is doing to solve such a critical issue.
Patients transported to Yale New Haven Hospital may not know what's going on behind the scenes, but what's being orchestrated before they arrive is having a direct impact on their treatment. Coordinating care for patients rushed to Yale New Haven Hospital begins long before they arrive.
5 Charlie 60, I have an 80-year-old male complaining of chest pain and difficulty breathing. Where would you like us?
Your destination is the York Street campus.
This is the Capacity Command Center on the 5th floor of Smilo Cancer Hospital at Yale New Haven. Chuck Babson, Regional Director of AMR, American Medical Response.
We have a nurse navigator from the ER sitting next to an AMR person with full view of the emergency calls in the system.
They're tracking real-time traffic of emergency response crews, transporting patients in and out of the York Street and St. Raphael campuses.
It was very easy for one hospital system to be overloaded, long wait times, while another Yale facility had no wait times.
The critical thinking happens in this room.
Everyone from patient transport, environmental services, AMR and the ambulance companies, the emergency department, clinical staff. We put them all in the same room.
Dr. Robert Fogarty, medical director of the center, says all this comes down to eliminating inefficiencies.
So if we have a patient that needs a bed, we want to find that bed, we want to get that bed clean, we want to get that patient in that bed.
The widespread flu season has led to out-of-the-box solutions.
Some example is we had some surgical units that had some empty beds and there were no surgeries planned, so we could put flu patients into those beds, and we identified those very quickly.
Meantime, it appears crowded at the triage desk, but the wait now is not as long.
We're clearly seeing benefit of, 10, 15 minutes, certainly, of getting patients in faster.
Dr. Andy Ulrich, vice chairman of the emergency department, says the more efficient response impacts patient outcome.
If we can direct them to the campus, to the emergency department, where we know that bed is going to be available, then the patient doesn't have to get back into an ambulance after the full emergency department workup, and they can just go straight upstairs.
Still, educating patients is part of the process.
People that are diehard stuck on coming to Yale want to come to Yale, and those people that want to go to St. Raphael's campus and have done so for years want to do that, but we need to have them realize that through education, it's better for them to go where the open bed is, where they're going to be seen quicker and more efficiently.
Dr. Fogarty tells me that on any given day, there are a total of about 1,300 beds available. The morning we were there, 1,355 patients were admitted, with 20 patients in the emergency department waiting for a bed. Jocelyn Mamenda, News 8.